Welcome back, everyone. When it comes to cancer, we all know that there are no boundaries. Anyone, including some busy Hollywood stars, can find themselves with a cancer diagnosis. In this case, it was a particularly aggressive form of breast cancer for actress Maura Tierney. She is a 3-year survivor, however, and joins us live via satellite with Dr. Patrick Cobb from the Frontier Cancer Center and Blood Institute in Montana. Good morning, and Maura, you're looking very well, so congratulations on being a 3-year survivor.
Thank you. Thank you. Congratulations to you. I wish I could. I can't see you.
I know. That's okay. That's okay. I can hear you, though, and it's fine. But let me talk a little bit, because I'm sure that chemotherapy was a part of your treatment.
Indeed it was, yes.
And that's what go ahead.
Oh, yeah, that's what I'm here to talk about, basically, with Dr. Cobb. I was diagnosed in 2009. I thought that I was only going to require surgery, that's all the treatment I would need. And then after, when we got the pathology report, the doctors were like, well, actually, you need chemotherapy as well. And I was really surprised, because I wasn't anticipating that. I was extremely anxious, and the chemotherapy scared me almost as much as the cancer diagnosis. So I'm working with Dr. Cobb on this campaign with Amgen, just to hopefully educate people about the myths surrounding what occurs when you go through chemotherapy, and hopefully just allay some fears and give some information to help people through it.
Doctor, what would you say are some of the most common myths?
You know, one of the most common things that people come and talk to me about is that, well, if I'm on chemotherapy, it's going to really limit my lifestyle. I'm not going to be able to go to the grocery store. I'm not going to be able to have my grandkids around, or if I'm not going to be able to take care of my pets. And for the vast majority of patients, that's just not true. Most people can live fairly normal lives when they're on chemotherapy. And so one of the things that we're trying to do with this campaign is to get more information out. There's a website that's associated with this campaign. It's called chemomythsorfacts.com. In that website, there's a lot of information about what happens when patients are on chemotherapy, and gives some links to some of the other cancer support groups. And I think it's very important for patients and their family members to visit that and to use that as a resource for information.
And there are links, as you said, to other patient support groups like American Cancer Society, Stand Up to Cancer, so that hopefully the website will work as a information funnel, so people will be getting only really medically based facts to help them understand what they're about to go through.
Because there is a lot of good information on the internet, and there's not so good information. Right. We feel that if we can direct people to medically appropriate things, that they'll have a better outcome.
Maura, how many rounds did you have? Were you did they say that did they recommend for you?
I was in treatment for 4 months.
Okay, that's about what I did. That's about what I did.
Yeah.
Yeah.
And how did you find? I found my experience to be a lot more manageable than I anticipated. I was afraid that I was going to be like, flat on my back. And how did you find? How was it for you?
Well, I think there were some things that I had some difficulty with, but I was able to go to the doctor and get help for that. So, and I think that's what a lot of people forget, is that, if you're having difficulty with one aspect of it, go to your doctor, and usually they have a treatment for that, and that can help right away.
Yeah, and ask a million questions.
Right.
Ask any question that don't be embarrassed about any question. None of them are stupid.
That's a really good point, Linda, is to get really involved with your physicians and your treatment nurses. They're a great resource for information that's medically tested and is the real stuff. So asking a lot of questions, as Maura said, there's no stupid questions on this. We actually want you to be very involved in your treatment.
Do I understand there's a video booth now that's going to be traveling around the country getting stories from people?
Yeah, as part of the campaign, there will be a video booth going around to several cities, and it's going to allow people to talk for a couple of minutes just about their personal experience of something they feel that they know now that they wish they knew before they started treatment, or just any information that they just want to pass along to someone who's going to be in the same boat.
Yeah.
So, and hopefully this will be sort of a beautiful thing to have everybody sharing their story.
It is a beautiful thing. Maura and Doctor, thank you both for taking the time to educate the public and ultimately saving saving some lives. We try to do it on our show as well, and you can't say it enough. Best of health to you, Maura Tierney, as well, okay?
Thank you.
You're so
Same
welcome.
to you.
Thank you. And Doctor, on with good work. We're thrilled about the kind of research that you're doing, so thank you so much.
Thank you, Linda.
Thank you.